And we're live.
And
hey, everybody.
Hello. Oh, hey, everyone. Welcome to In Time, and thank you very much for coming. We are simulcasting on the GDC and on our channel. I hope you will like and subscribe to both, but more our channel. Come over to the dark side. We are here to discuss the circumcision, specifically male circumcision. It's a topic that hasn't been discussed very often. Often you'll find that people discuss the female circumcision. I think we'll probably touch on that briefly, but I think because this is so often practiced and is often ignored, that we are going to spend some time on it. I also, and Ansgar, I told you this was going to happen. I've gotten notification of a possible breaking news story, so I'm going to try to start staying on that. I don't know if we're going to switch over to that or not. It depends on the story, but since we do cover breaking news, that is a possibility. But in the meantime, I would like to remind everyone, tomorrow we are going to be discussing biblical prophecy, and I hear Jim Majors has come up with something pretty astonishing for that. And so I'm looking forward to having Jim on to explain it. He is an expert in biblical prophecy. That's what he studies. He is a former minister, former head of the Atheist Republic, or former CEO of the Atheist Republic. So he's going to be on to discuss biblical prophecy, which is one of my favorite. I've studied Daniel in particular, but so that will be tomorrow. And then on Thursday, we will be discussing gun control, in which I hear there are varying opinions of the hosts. There is the correct opinion, and there is Ansgar's opinion, and we will learn about that on Friday. Or sorry, on Thursday. And then, like I said, I will keep up on that. And we have both our guests, which for a second it looked like might not happen. So, but I would like to have each of you introduce yourselves, please. Let's start with, I'm sorry, is it Jen?
The pressure.
The pressure of introducing yourself?
Oh my gosh, can't handle it. Hi.
Okay, I will introduce you. So Jen is a really nice lady, and she's a mom. She's here as a mom. She's also a nurse, we found out. She's a comedian. She tells us professionally. I don't buy it. I didn't think she was that funny in the green room, but who knows? We'll see. If I keep talking smack, I have a feeling she's going to show me up. So I think I'm going to try to dial it back a notch. But
I never said I was funny.
So if I haven't offended Jen too much, hopefully she's had a chance to compose herself and answer one of the most difficult questions in life. Who are you?
I am a mom who circumcised her son for religious reasons. I'm an ex-Muslim and an ex-Mormon. So that's basically where I'm coming in from. I'm coming in from an emotional standpoint more than a medical. Although I have my medical reasons for not wanting it and my own experiences, I'm absolutely against it. But we'll get into that. But that's me.
All right, and Phae, could you give us your experience?
I'm Phae. I've been a trauma nurse for 14 years next month. I am against circumcision on infants or children if they're medically necessary, but not against all of them in general.
All right. So, but you said you're a nurse?
Yep.
And is this a procedure that you've seen and have some experience with?
I have. I'm a
right.
trauma nurse, so I normally only get to see the bad side of it.
Ooh, so when it's
When it
gone
becomes an emergency,
wrong.
we come into the emergency department. That's when I get to see it.
All right.
So
all
I
right,
guess I'd
thank
like
you.
to open up with a couple questions, if you don't mind, Nick.
Oh, please.
So one of the things that I hear the most in response to pushback against male circumcision is that female circumcision, FGM, is far worse, and so we shouldn't really be worrying about male circumcision. And I know, Phae, that you have said a few things about this. I'd love to get your response.
So, Jen, being Muslim, would probably know more about it. I have seen it. So when you look at female genital mutilation or female circumcision, there's varying degrees. Some places just pick it with a pin,
Mm-hmm.
and other places will remove the entire clitoral hood. And they do that for the same reason that we do male circumcisions or the same excuses. It's cleaner, you're not going to have buildup, so forth and so on. Now, a misconception people have is that this somehow takes away a woman's ability to have sexual pleasure. It does not. You cannot remove the entire clitoris. It's a huge organ. It goes back up inside us. They literally remove the hood from on top of the piece of the clitoris that is showing, that is visible, external.
Interesting. So what? Obviously, there's other more serious forms of
Yeah,
FGM.
there's actual mutilation that occurs in places like Africa. There's some tribes that remove a lot. There are some tribes that will stitch a woman up to keep her pure, like to close the hole.
With just
So
enough room for bleeding, and
yeah.
that's it. Yeah.
But overall, when people are talking about female circumcision, they're specifically referring to Muslims. And Muslims are, like I said, two ends of the spectrum: pick with the prin or remove the clitoral hood.
Got it. So when the clitoral hood is removed, is that remotely analogous to removing the foreskin?
Pretty much. They're both sensitive organs. It's to protect the clit, just like the foreskin protects the head of the penis. And people just don't seem to understand that smegma is a part of being human. All you have to do is wash. It
What
doesn't
is
help with keeping clean.
what is the function of the foreskin?
Oh, goodness, there's a lot. So, the foreskin's main function is to protect the head of the penis and to protect the glands. Like the vagina, the penis is self-cleaning in a sense that it self-lubes. It's got cosmetic protection. Now, as an infant, when you're born, your foreskin is fused closed. Now, this is to protect your infant from contaminants, infection, and metal stenosis. So, literally, it's there to protect. It works kind of like I don't know how to explain it, a sphincter at the tip, which serves as it's a barrier to keep out environmental contamination. It protects your glands as you grow, and as you know, it's fused until you're around 7 to 10. And after that, it protects your glands from chafing. It stores and releases natural lubricants. It also works during sexual function to roll and glide and provide lubrication. Um, so it
Real quick,
does have a
I have
lot
a
of uses.
comment here from Jim Majors. Says this is false. They also remove the clitoris in some cultures.
Okay.
Well, so okay, so I think he's saying is it's false that that I think what he's saying is that so there are some cultures that go much further, which I think you had also said, but I think he's saying
Yes.
it's a slightly larger group than you may have said, but it certainly I don't think it's
What would you have to do to remove the entire clitoris?
that's a really good question.
Okay. Well, you would have to perform major surgery. The clitoris goes all the way back up behind the uterus, and it's a like I said, it's a big organ. So we would probably I never thought about how we'd have to do this. You'd have to open up the abdomen and remove
How would they do that?
the entire thing, much like a hysterectomy, I guess.
So likely, when people are talking about removing the entire clitoris, they're probably talking about just the visible
Yes,
piece.
the exposed bit.
Got it. Okay.
It's a really small piece of it.
Okay. Not that that's makes it okay. Not that
No,
that makes
Yeah.
it acceptable.
I
So-
don't think we should be removing sexual organs, period.
Right.
So the American Society of Pediatrics, as I understand it, their current position is that while it's not necessarily even recommended surgery, although they come awfully close to it, at least for, again, just talking about the males, that the benefits do outweigh the risks. And so when we talk about, okay, it helps keep the penis clean, what they're saying is yes, but it reduces the risk of HIV, it reduces the risk of HPV, HPV-related cancer, and that it doing so has greater medical benefits. So if we remove the religious arguments for a minute, which I think we're going to get back into, but I mean, for now, just looking at the argument that, well, hey, the penis is self-cleaning. What do you have to say to that argument?
Okay, so I was a practicing nurse in the United States, and I have moved to Canada. And the US stance is the exact opposite of the Canadian. It's also opposite of UK and every other Western country, which states the risks do not outweigh the benefits.
Mm-hmm. Okay, so
I don't.
it
I think. Sorry,
yes,
I think
please.
I was a nurse in the UK. I have not really done any nursing in a hospital setting in the US. I went into like care of the elderly in the US. But I was never present for circumcision in the UK because, like I said, you had to pay as a private practice there. Absolutely. It is not necessary. It's not medically necessary. They won't cover it even. No. And that's
Can
the
we get
exact
you to
opposite
get
of the
closer
US.
to the mic, Jen? We can barely hear you.
Yeah.
I'm sorry.
That's okay.
Is that better?
A
Y'all
little.
don't want to hear me anyway, so.
Oh yes, yeah. There's a reason
We
we.
absolutely do.
So yeah, so no, like Faye was saying, the UK is the exact opposite of the US, and the US, what the US teaches as far as circumcision and whether it's medically necessary or whether the risks don't outweigh the benefits, because I think most Western countries say that the risks absolutely outweigh the benefits, and there are no benefits really, unless it's medically necessary, of course.
Correct.
So what is there a reduced risk of things like HIV, like many people, claim?
We don't know.
We don't.
No. We have studies of both sides of the argument. One of the things that was pointed out to me by a doctor here was that when these studies were done in the US,
Mhm.
they did not account for all they accounted for was whether or not the person was circumcised. So they put an uncircumcised sex worker in the same category as a circumcised married person who has only had one sexual partner their entire life. And that throws off their numbers. Other
Right. So
countries'
they
studies
only
show that
accounted
it's
for one
not.
variable.
Right. So, in all honesty, we don't know because it's really hard to determine something like that when you take into account individual people's lifestyles, sexual partners, do they use protection? Um, are they using condoms regularly? Do they have multiple partners? Are they in a monogamous relationship and both partners are faithful? Things like that we're not taking into account. So while more studies are being done, in all honesty, we don't know for sure.
According to the studies, do you remember offhand what the percentage was of reduced risk according to the studies?
I would have to look it up. I
Okay.
think. Give me a second here.
Yeah, take your time.
Was it also mentioned HPV? Did I hear HPV?
Yeah, HPV was mentioned, and I think I may be
Syphilis,
wrong.
AIDS, they've checked all sorts of things.
But now
I
we have
think it was
vaccination for HPV too.
yeah, I think it was 1 in 20, they said, of cases prevented. So if you would have had 20 cases, one person, and this is just a study in Africa that I had seen, would have not gotten AIDS if you had circumcised all 20, one of them would not have gotten AIDS.
It's kind of like, why don't you
2%.
remove uteruses to prevent cancer?
Well, my argument is if we're removing foreskins to prevent cancer, when the odds of getting any sort of form of penile cancer is 1 in I think Norway said 1 in 67,500 some odd. Your odds of getting breast cancer are 1 in 8.
May as well
So
just take
that's
those
not an
off.
excuse, or we'd be cutting off breasts when they start to develop. You're at far higher risk.
I mean,
And
if that's the case, then even the 1 in 20 for HIV, if you're
So
going to
here
make
is the
that
African
case,
study.
uh,
There was a 2% difference between
2%.
circumcised and not circumcised.
yeah,
So circumcised reduced, quote unquote, reduced risk by about 2%.
So that would again bolster the idea that if we're going to circumcise to prevent HIV, we may as well be cutting off breasts to prevent breast cancer.
Right.
And then we
Because
could
your
talk
odds are,
about the risks and the infections and the boys that lose their penis and the sexual dysfunction as they grow up.
depending on the country, the odds of botched circumcision ranges from 10% to 35%.
wow, that's
With
pretty
the best
staggering.
country being Australia at 10%.
Really?
So in the U.S., it's a higher than 10% where they botch it.
Yeah, it's the US is right around the 20% mark right now.
Wow. Now, what does a botch constitute?
A botched circumcision constitutes any long-term complications.
Okay, so
Okay.
cutting it too short, cutting it too long, some permanent reoccurring
Correct.
infection, misshaping, something to that effect. Permanent sexual.
Correct.
All right.
I have an
Uh,
anecdote or a personal story. I had a partner that had when he would get erect, it was bent in a weird way, and
They
um,
cut it too short.
well, no, there was still some skin attached, so he couldn't get completely erect. Like there was
Okay.
still like
Ooh.
there was some fusion, and it was just a tiny bit, but it was enough that it pulled every time, so sex was painful. So he had gone 35 years of his life with painful sex and painful erections because of that little bit of skin. But didn't your mom ever look at it, or when she was changing your diaper, notice that? I just thought that it was quite a decent amount, but
Oh,
he had to go as an adult and get it fixed because I was like, you can get this
Ooh.
fixed. It doesn't have to be painful. Like it just a little slice. I'll do it. He's like,
well,
no, 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 no.
yeah, I'd probably say no too. I'm just saying.
you're the mother of a circumcised son, so when you were changing his diaper, there would have been a lot of blood. It was an open wound. The entire head of the penis was skinned.
Yes,
You probably wouldn't have noticed a little extra skin hanging
that's
there.
true. That's true. Especially because it gets so angry. Oh, and the
Yes.
screaming when you change. Oh, I will always hear those screams.
Yeah,
Yes.
my wife actually uh, uh recorded a story about her experiences with this sort of thing that kind of relates. You want me to play it now?
Sure.
Yeah, yeah. Okay, let's do that.
Okay. It's about 7 minutes. I apologize for the length, but it is quite the story. If it's too loud, let me know. But I don't think. Here we go.
Hi, folks. It's Scrally Bite Bite. I'm going to tell you the story of both of my son's circumcisions and how
Well, I agree. It's not too
the
loud.
experience affected me.
I don't
First
think
of
you guys
all,
can
I
hear
never
it.
wanted to
This is
circumcise my
amazing.
No, we
children,
can't.
but I wasn't
I
strong
can't
enough
hear
at
it.
the
I don't
time
know.
to stand
No.
up to their father.
Okay.
I can't either.
This was going straight through to the because I'm playing on desktop audio. This is going straight to the viewers. Very sorry. I'm not sure how to pump it into you guys as well.
All right.
Hi,
Well,
folks.
Ansgar,
It's
I'm going to
Scrally
hit you
Bite
up with a
Bite.
quick DM. So maybe restart it because we've been talking over it. Restart
Okay.
it. I apologize. It's unfortunate we won't be able to hear it or comment on it. Maybe you can relay the contents of it, but why don't we do it that way?
Okay. All right.
You can let us know when it's done and mute us until it's done.
Very sorry. I forgot that would be a thing.
All right. Are we muted?
Hi, folks. It's Scrally Bite Bite. I'm going to tell you the story of both of my son's circumcisions and how the experience affected me. First of all, I never wanted to circumcise my children, but I wasn't strong enough at the time to stand up to their father, who insisted on it. Not that that's an excuse, but that's how it came about. His excuse for it was he wanted them to look like him. That's the entirety of his reasoning. And he insisted on it. When my eldest boy was circumcised, we took him to the clinic because we didn't have the money to have them do it at the hospital. They took him away to a room, and you could hear him screaming bloody murder. The doctor came back and shoved him into my arms. Not even handed him to me, shoved him at me because he was angry that he defecated on him. You just cut off a piece of his penis. Of course he's going to have some adverse bodily functions. Told us to go home and change the bandage at his next diaper change. That was the extent of the directions we were given. When I went to change his diaper, the gauze that they had put around his wound had adhered to the wound. They did not put enough ointment to keep it from sticking. This child, who's barely a week old, is in severe pain, has an open wound, and I can't get the gauze off. It's stuck. The only thing I could think to do was soak it. We soaked his penis for 8 hours to get it to release a majority of the way, and it was still stuck at one point that I couldn't get off. I called the nurses at the hospital, and they said I had 2 options. Bring him into the hospital and they'll yank it off because that's the only option. Or I could yank it off at home myself. No care for the pain that he's in. No real, just so heartless about the way they said it. They had, so what? He's in pain. He'll get over it. He'll never remember it. He's just a baby. They told me if he started to bleed, then I would have to bring him in. So I'm stuck there with my newborn, and I have to yank off the gauze off of his wound. He's been screaming, mind you, for 8 hours as I'm soaking this wound, trying to get this off as gently as possible. With no other alternative. Thankfully, he didn't bleed badly after that. But it was horrific. And looking at his penis afterward looked like raw meat. It didn't look like the doctor took any care. He definitely didn't use any painkillers. It was horrifying. And the guilt that it's horrible. I don't, their day doesn't go by that I don't regret it. When his little brother was born, we couldn't give him a circumcision for almost 3 months because he was so premature. They let me sit in on this one. I figured if I had to get him circumcised, that I should have to watch. I should bear some of what he bears. I watched him strap him down to the board. This doctor at least used some local anesthetic. There was at least that much care. And then he got out these instruments that looked like torture devices from medieval Europe. They used, in fact, in part of the procedure, they use safety pins of all things. They have to cut part of it off and then safety pin it back together just to cut the rest of it off using these weird devices that stretch them out and then cut. And then, of course, the healing process. I wish I had been strong enough to tell my ex where to step off. He wasn't there to watch this happen. He wasn't there to support his son. He just insisted that it happen for the sake of not looking different. I'm very lucky that I have boys that have forgiven me. I don't think I'll ever forgive myself for doing it to him. I could have said no, and I didn't. And I put them through something horrible and unnecessary. And I took something from them that I can never give back. I wouldn't have even thought about protecting my daughter. Why didn't I think to protect my sons the same way I would protect my daughter? It's not right. It's not fair. We should protect our children equally.
All right, it's over, guys.
Okay, I didn't get to see it, so I have no idea what it was.
Yeah, I know, and I'm very sorry for that. But my wife was recounting her experiences, and Nick seems to be muted.
I listened to it.
Okay. Yeah.
Right. So could you give us a brief précis of it for the two of us that didn't catch
Yeah.
it?
She talks about her experiences of being basically bullied by her ex into getting the procedure done on both the boys, and the guilt she feels now. And thinking back, I think the most, stark thing about that whole thing is thinking back, she would have never allowed the same thing to happen to her daughter, what I consider our daughter now. But she would have never, no matter how much somebody pushed, would have allowed that. Why didn't she have that same kind of resolve to protect her sons? And she feels really guilty, and she feels very blessed that she has sons that have forgiven her.
And the answer, don't feel guilty for what you didn't know about. I mean, and that's one thing when parents are upset, especially the parents I have to deal with are the ones that something went wrong. They're in the emergency room. They either have an infection, they're bleeding, something's going wrong, and they blame themselves. The information is not out there. People don't generally know. It's become such an ingrained part of tradition that most people don't think twice about it until something goes wrong.
We have someone in the chat right now who's talking about that they did it for tradition. In fact, Alexis B says 100% I would do it again. My husband and I are very happy keeping our traditions alive, and having it done by someone who only does circumcision. That's his job.
Well, and let's assume for a second that, okay, someone who does only circumcision could reduce the rate of problems below 10%. And let's assume, in fact, that they can reduce it entirely. First of all, as I understand it, isn't the foreskin actually considered to be the most sensitive part of the penis? And before you answer that, then that gets to the second question. If there are 37 industrialized countries in the world, if 36 of them say that this procedure is at best unnecessary and does more harm than good, and in some cases considered actually a violation of human rights. The fact that ours is the one exception, does that necessarily say that it's okay to do it for tradition? So that's up to the panel, I guess, to the both of you. I'm just asking what your thoughts are on that.
No.
Yeah, no.
Circumcision is the #1 cause of male infant death. It knocks out
Really?
everything else. It is the #1 cause of deaths in male infant boys.
More than
A new
SIDS?
study just released states that it increases your risks of SIDS by 35% because of pain and shock. These are not risks that you put on an infant. They cannot consent.
They could do it when they're an adult if they really want it done.
Absolutely.
And as to the, I mean, as I understand it, it is the foreskin that, and in fact, in many males, they can have an orgasm just by stimulation of the foreskin alone. It's got that many nerve endings in it, and it's
Over
that part that's getting
20,000.
cut off.
Yes. Over
Okay.
20,000.
And this is where my guilt comes in, because with my son, he's acutely aware of everything he's lost, and has been very, very forthcoming with me about how it feels.
Would
And
would would you be
pardon.
willing to? Yeah. Well, you're already sharing it. I interrupted you to ask if you'd be willing to keep sharing it. So I think you have a letter, and do you want to tell us about that?
Yeah, I have to pull it up. I asked him. I think my mic should be better. I turned it up on my settings on my computer.
You sound much
It's
better,
fine.
yes.
Okay, good. I had it set to like 70% because I'm dumb. So I asked him, I apologize for background noise as well. There's gardeners if you guys can hear that. I asked him if there was anything in particular he wanted me to share, because I have a YouTube video as well where I talk about my feelings about circumcision and doing it to my son. And because none of the men in my family are circumcised, except a younger brother. He had to have it done for medical reasons. So my father called me an animal and a monster for wanting to do it to my son. The Muslims are on my mom's side of the family, so on my dad's side, they were very anti-circumcision. So my son told me he didn't mind what I talked about. He just wanted he had a letter to share, and I was going to read that if I can get through it, because it's hard for me. So I'll go ahead. I just pulled it up.
Thank
If you
you.
guys, okay. I know that as time has gone by, I have found myself to be complacent, yet the feelings which I used to fester still linger. I doubt I will ever feel okay with the way I am, but rather I can grow more complacent in time. I still sometimes feel nauseous when I think about it, and I still sometimes feel shrivels of horror that once was abound. Allow me to elaborate on my past. I had been told I was circumcised. It was a thing I knew. It just never really stuck. It was just something I didn't think or care about. I didn't know. Then I got older. I don't know entirely how, but I felt something was wrong. My boy bits didn't seem to look or feel right. So I did what one might do. Upon researching the topic, I realized it was this circumcision thing I had been told happened to me. And then I spent the rest of that week doing pretty much nothing but research. I learned that the claimed benefits were pretty much bullshit. I learned that circumcision was originally put into practice to reduce sensitivity and prevent masturbation. And most of all, I learned that Kellogg's cereal had a pretty fucked up history. More specifically, the guy named Kellogg himself. I was a little kid and I didn't know how to process all this. I think it began with terror. You might recall when you were a little kid, one of the most horrific things you can imagine is your genitals getting permanently disfigured. Well, guess guess what? My nightmare came true for me. I wasn't angry or sad. I was just horrified. I was horrified that in one singular life I would ever have, I wouldn't even get the chance to play my cards straight. Someone took some from my deck. But as the saying goes, I still had to play the deck I had. I still felt broke. Hell, I still feel broken sometimes. Sure, I moved on, mostly, but I recall nights of hitting walls and pillows and wishing that my reality wasn't real. It was like a mix of denial and fantasy. I started cutting myself. I started cutting myself to ease the hole in my gut. It was like this empty feeling of dread that was nonstop squeezing on your chest. The only thing that pulled me out of it was learning about foreskin restoration. I knew it wouldn't be a perfect fix, but at the least I could do something about it. I still had cards to play. I don't know what I would have done had I not learned of that. I am not sure I could have left the loop of dread and cutting I wound up in. I tried to reach out, I really did. Of course, I was scared too, mainly because of the stigma that comes with talking about one's genitals. I tried to tell my friends at school, but I only scared them away. I tried to tell my mother, but she didn't really seem to come around then. I recall a visit to my grandmother when we were eating crepes, and my mother talked about having not circumcised my sister in front of me and how happy she was that she didn't. My grandmother talked about how great circumcision was, and I sat there and sat silent. I knew about foreskin restoration for years, and eventually my mother came around, but only a little bit. I told her of the foreskin restoration, and she promised she would look into it, but she didn't. Still more time passed, and it wasn't until right before Christmas, I guess she tried her research then, that she came around, and she came out crying and sobbing. Was I being melodramatic? I don't know. Well, to all you folks who would say I was, from the deepest parts of my heart, I wish to say that I honestly think you can all go fuck yourselves. That's from my son.
Wow.
So,
Sorry.
generative. He's talking about being able to regrow the foreskin. There's a couple of companies. The forefront one would be Forgen, based out of Italy, I think. They've already managed to regrow foreskins on bulls. So we're looking at maybe a decade before it becomes available to everybody. It's been pretty successful so far. It works kind of like a salamander. Now, they hadn't originally started this to regrow foreskin. It was originally started to regrow tissue that was lost by injury or disease. But they found that it's actually quite successful at regrowing your foreskin. I don't know all of the details of it. I know it involves stem cells and that it's been successful in, like I said, bulls and other animals. I think we're trying monkeys next. But they're the forefront. There's some other companies coming up behind them. Another one uses 3D technology to basically 3D print new foreskins. I'm not sure how they plan on grafting those on, what kind of surgical procedure that would be. Same with 4Gen. I'm not sure the details and how it works, but I know that they're having successes. So there is hope out there for
Wow.
those that genuinely want their foreskin back. It's just going to be a few years.
Well, thank you very much for reading that, and thank you for sharing that.
Every time I do it, I can't not cry. Ugh.
Yeah.
I wouldn't be able to read it.
No.
I don't think I
I
can either.
was
Stronger than I am.
choking up while you were reading it. I as a personal story, I haven't had to deal with, I have adopted kids, but they were older by the time I adopted them. I didn't have to make that choice, or I wouldn't have made that choice, but still. But I am cut. My mother had me circumcised because raised Christian, and I can tell you that there are definitely some things about the way my penis works I wish it didn't. I have a large amount of calcification on the head of the penis,
It's
and
Fred.
Yeah, and I'm sure you can speak more about this, but the head of my penis is very much not very sensitive. Most of my sensitivity is now in the shaft, which isn't the way it's supposed to be.
So it's all a scar tissue.
Okay.
So when we
Where does
do a
the scar tissue come
circumcision,
from? The procedure itself, or
yes, again, when you're born, the foreskin is fused to the head of your penis.
Hmm.
So we go in with a tool. There's 3 separate tools we use, and I won't go into details. They're pretty brutal. Basically, what we do is we go in and we have to rip the foreskin off the head of the penis before we can remove it. So what's left is scar tissue as the skin regrows.
So it seems to me now, I think it's interesting. In the United States, it's not as much a religious thing. Now, the numbers were, I think, 30 years ago, it was, no, 40 years ago, it was 83% in the US. Now it is 77% of males have this done. So it is going down. But like,
2019, as of 2018, I believe the numbers are 51%.
oh, wow. Oh,
It's way too much.
that's even better.
Yeah.
So I
Still.
think that's good. And I think there's now, it's changing. Clearly, I think the fact that the American Society of Pediatricians essentially endorses this is what gives people cover to do it and to not have to think about it despite, and to do it for and say, okay, it's okay that there are people who don't like it. It is my tradition, and the best medical minds, including the Mayo Clinic, says it's okay, and so does the National Institutes of Health. So if they all say it's okay, then you can't ignore my tradition. But what I want to ask is, what do you say to people who sit there and say, this is a profound religious commitment that I have made, and it, in fact, and especially in Judaism, it cements my covenant with God, and you have no right to say I'm wrong?
I have every right to say you're wrong. I have had patients who died, children who die because of their parents' religious beliefs. You don't believe in blood transfusions. You don't believe in medicine. You don't believe in insulin for diabetics. You don't believe in this, that, or the other thing. Your religious freedom stops where somebody else's bodily autonomy begins. You can
okay?
have your faith. You cannot let somebody die because of it. If you want to die because of your faith, that is your choice. You're an adult. But you cannot make that choice for others. There is a hard line where your religious freedoms interfere with the basic human rights of others.
Brainy Beaver is, I think, basically kind of responding to you. Phae says, "Why give girls a vaccine for HPV then, and not let boys have a better chance of also avoiding it by 30%?" I think he's talking about the HPV claims of
Does
for
a vaccine remove your
Vaccine.
fucking penis?
Well, we do vaccinate boys and
What?
girls for HPV.
Does
So I
the
don't,
vaccine remove a portion of the penis? I don't understand that. I'm getting angry. Like, what is that?
so I don't understand it either, because you can have your son vaccinated against HPV.
Yeah, my son
Yeah,
has been vaccinated for it. I don't understand. Like,
That's what I
what is that?
understand.
How does that have anything to do with fucking cutting off a portion of a child's penis, an innocent child? That is that. Oh,
it does seem to me a bit to be comparing apples and oranges, because one's a shot, the other one is a medical procedure that permanently alters the body, and
But
that
I said just remove the uterus to prevent cancer. Why not do that?
as an adult, when you try to get a circumcision as an adult, it's considered a cosmetic procedure. It's a body modification. So unless it's medically necessary, your insurance isn't going to cover it once you reach adulthood.
You will never forget the screams, ever. They will haunt you for the rest of your life. The mothers that get to send their children away and have it done and the child brought back. Those stories, these happy little stories of these little bundles of joy that you bring home without screams is not true. They scream every time they pee.
Well, at
Every
first they
time.
go into shock.
I'm sorry, what?
At
Yeah,
first they
that
go
is
into
true.
shock.
Oh, yes.
Like every diaper change, every time you have to treat the wound, they scream.
I
Yeah,
never went to
that sounds
neonatal, and
different than a vaccine. That sounds different than a vaccine to me.
Yeah.
Um,
Chesh
and
Vic brings up a good point. Why are the women more upset about men losing parts of their dicks than the men are? Is it because the men don't want to talk about it because it's traumatic? I don't think it's just traumatic. I think there is an impetus for men. A lot of our ego is tied to our sexual organ, and to admit that we are in any way not perfect and virile in every possible way is a blow against our ego. And so I think there's a lot of ego tied into pretending like everything's okay and we're, you know, there's no possible way this could have damaged me, you know.
well,
when you
and
look at
please.
inactivist sites, it's mostly men. Like the
Mhm.
inactivists that are on the streets, the inactivists that are publicly speaking out. There's entire sites that are mostly men speaking out against it. There's not a lot of women in the movement.
I do think there's another thing that's going on with men, which is I think unless you study it, it seems perfectly natural. Obviously, you
Right.
don't remember a time beforehand. So unless you've studied it and looked up to it, which is I think what happened to Jen's son, you don't know. And I think what happens is once you're aware that maybe there's an issue, you're disincentivized against trying to learn about it because honestly, what can you do about it? And it can add to depression. It can cause all sorts of problems. So I think men are more inclined, it's even, I think, somewhat of a level of denial where they'd almost rather not know or look into it or engage it because it's just easier to say, I am what I am now and I'm okay with it because I don't really have much of a choice and I'm going to move forward. Not that that's how everybody responds to it, but I think there's a psychological incentive to respond that way. But I think Cheshire Vic asked a spectacular question. I think women don't have that incentive, so I think they can see it as a human rights issue, and I think they can engage on it. And I think it's harder for men who have to admit that something happened.
As far as I was going to touch on the religious reasons.
Yes, please.
I would never have done it if not for religious reasons. Like I said, the men in my family were not done. It was something that my father was very, very much against. And the reason why, uh, I had told this story before we had gone live, but I. I I had a phone call with my father. My son was in NICU and was being released. And so they were going to perform the circumcision before he was sent home. And I insisted that I was there in person. I didn't want it to be done if I wasn't there, and I wanted him to be numbed. I did not want him to feel pain. Um, those two stipulations, I signed the paperwork, and I went home to go get some rest because I had been in NICU with him. And I had a phone call with my dad, and my dad called me a barbarian and a monster, and said he would never forgive me. And so I called the hospital to tell them to take him off the schedule and not to do it. And they told me that they had already done it. And not only had they already done it, they hadn't numbed him. Uh, I couldn't stop it, and I tried. Even
So
with my religious convictions, I was willing to risk hell because there was something inside me that just felt fundamentally wrong.
they don't do circumcisions without
They did
anesthetization.
a
They use
lidocaine.
what's
I
known as the dorsal penile block. Canada did a study in 1997, or tried to do a study, where they needed a control group. So they took a group of baby boys. Half they were going to do the procedure, circumcision without anesthetic, and the other half they
Oh
used the
my God.
dorsal penile nerve block. So what happened is the babies that were not anesthetized were in so much pain that it was unethical to continue the study because the babies began choking, having seizures, and two of them died.
God. Oh my God.
You need to have a study to tell you that that's what's going to happen if you attempt this without anesthetic. It
Yeah,
wasn't until they actually started trying that somebody figured out this was a bad idea.
They
yeah,
used to believe that babies didn't feel pain, right? Like they would say that the
yeah.
baby
And
boys
this
didn't
this
feel any
study
Oh
pain.
is
my
the one that
God.
definitively proved that that was a myth.
Oh,
That's why they had to
duh.
do it.
I'm sorry. I didn't realize you had to prove it. I've got 2 kids. I'm aware that oh my God.
Yeah, they had to prove it
I'm
because there's a
pretty
lot
sure
of
it was
people who
hardened.
still believe that.
Yeah, I've heard that even still today, that
Yeah, I hear it
newborns
Really?
too.
don't feel
And
pain.
it's like, no,
Yeah.
no. And they're like, well, prove me wrong. So you have to resort to this actual study to prove people wrong on this. So it had to be done, and it's horrible.
Well,
But
it's
they
not like
also found that the dorsal penile nerve block does not block all the baby's pain. That's
No,
why they
it
go into
doesn't.
shock.
well, and Ansgar has provided some images that have been scrolling through the top. Our guests may not be able to see them, but it certainly does not look like that's a painless procedure to me.
Oh no,
No.
it's not.
And I'm actually willing to buy that the kids don't remember it. I think that's probably likely because of infant amnesia. That's fine. That doesn't mean that is absolutely and in no way whatsoever excusing of causing the pain. That's like, say, just out of curiosity, if I could make someone forget a rape, does that mean that the rape is okay and that you could go around raping people so long as you made them forget it?
So there's also some parts of Islamic. There's some Islamic sects. It also is part of African culture as well. That they do breast ironing, but it ties in with Islam loosely, very very loosely. Um, so
What
when
is
I was a nurse,
breast ironing?
yeah, when they breast buds start developing, they put hot metal and deform the breasts so that the women are not attractive, so they don't get raped.
Oh my
And I took
God.
care of a little girl that I was in the UK that passed away from an infection from that. And actually 2 little girls. One actually survived, but the other one passed away. Um, it's done now within the immigrant populations in the UK. Not so much in the US, but it still does happen in the US. So
Not
that
so much here
also
either.
it's a religious belief, right? It's like a circumcision type thing. And so if my religious conviction is that, or belief is that, God says that I have to mutilate my child, at what point am I allowed to do that? Like, at what point is my child's body autonomy theirs? Why do I get a say over the law, like permanent damage to my child? Why would I be allowed to do that because of a religious belief?
Wow.
Yeah, that's a little stunning.
It's the same.
Uh,
It's the same. I mean, you're
yeah.
cutting off a part of the penis.
Yeah.
You're
So
causing irreparable damage.
And
one
you're
of the
risking
responses,
death.
yeah. Well, one of the responses I hear commonly, and I've heard it a lot lately, even from some prominent people in politics and religion, is that bans on circumcision are anti-Semitic.
Or Islamophobic, right?
Right,
Yeah.
right. The big one I hear is anti-Semitic, but
Yeah.
once in a
Oh,
while
yeah, the one you're gonna hear.
Islamophobic.
Yeah.
Yeah.
Going back real quick here to the pain thing, keep in mind only 45% of doctors who do circumcisions use anesthetic at all.
Oh,
Less than half. Most are done without any.
That's why I was so angry, because I asked for some anesthetic, at least lidocaine, and they didn't. So angry.
All right. I think unfortunately we're heading up on a bit of a time limit, and there's a couple of different reasons for that. Not the least of which is unfortunately I'm going to need to head out soon. But we have about 5 minutes left. Excuse me. So if I'd like to hear sort of Ansgar's final thoughts, and then everyone else's, and then there's a couple of things I want to discuss, and I think we're going to have to head out on that. But Ansgar, is there anything that you had that you wanted to say?
well, first of all, we're going to open this discussion up a bit more in the after show, and if Brainy Beaver is still up to, defending his position in the after show, that will be available. It may be a little bit delayed because we have a breaking news story to cover. But we are still doing the after show, and that's going to be my channel. Link is in the description. Just know that we might be a little bit late. But before we go on to that, My thing is even if we take for granted, even if we take for true all of the medical claims about all the positive medical claims about circumcision, every last one of them, there still in my mind is no reason to perform a circumcision on a baby, on a child, unless there is a medical need such as what's that called, phimosis or whatever. um unless there's
Children don't
some
get phimosis.
well, there you go.
The
So
foreskin's fused.
unless there's some special reason they need that circumcision, there is just ethically untenable as far as I'm concerned. um I don't see any plausible defense, 'cause even when you go with the cleanliness, what are we gonna do? Start chopping kids' ears off because kids forget to wash behind them? Kids stub their toes and get toe fungus. Let's cut those off too. And pretty soon you get to this ridiculous point where, kids are left sightless, toothless grubs, no legs, no arms. I don't I can't defend it. But anyways, those were my final thoughts. It is a hard topic to really formulate my thoughts around, to be quite honest.
I'm shocked I didn't yell more.
You'll get to yell more in the after show.
Anybody who uses cleanliness as an excuse don't know children very well. It was easier as soon as the foreskin started to be able to retract. My nephews, it was easier to teach them to clean their penis than it is to teach them to wash their hair. They had a blast playing with this new thing.
I'll
I
let 'em
mean,
know.
it moves. Oh,
And then, okay, sorry, Jen,
I
any final thoughts?
I think
Other than you're glad you didn't yell at anyone.
yeah, I'm really glad that I didn't yell very much, just a little bit. I got angry, but that's about it. No, I think I've said my thoughts on it. I think that my feelings and my religious beliefs and whether or not I think the child should look like their father, I don't have the right to alter my child like that. That's something they can choose when they're an adult, and I will never be able to undo what I did, and my son is the one who has to live with that. I have to live with the guilt, but he has to live with the problems that have come from that for the rest of his life, and it's terrible.
All right, Phae, did you have any last words you wanted to say?
just some words of encouragement for Jen. Uh, he may not have to live with it for the rest of his life. We're
Oh, I
coming
hope
along
not.
rather quickly with regeneration, and if it's something he wants to do, I would definitely, if I were you, support him and look into the different methods. It looks like it's becoming available in the UK first,
He's
so
gonna make me pay for it. Watch.
it'll be available to you long before it is over here.
That's
So
exciting. I can't. I'm really, really looking
there's
forward to it for
several.
him.
There's four. I thought there was only three. There's four companies that are doing it right now. So
It'll alleviate a little bit of the guilt, but
there you
I
go.
don't know. I worry about the nerve endings. Like, does it bring the nerve? Well, we could
Yes.
talk about that.
Yeah, we'll talk about that in the after show.
Yeah.
Yeah.
And
All right,
Ansgar, you're gonna have to DM me that link.
Yes, we'll get you that link when
Well,
I make the
yeah.
hangout and stuff.
Okay.
we'll make sure everyone's connected. Yeah, I think one of the things is it's a holdover, especially in Jewish tradition. There's a lot of Jewish traditions which made more sense at the time. I think the cleanliness was an issue back then. I still don't know that it was worth it, but it was much more of an issue back then. They didn't have modern hygiene, and now with modern hygiene, the cleanliness certainly isn't nearly the same issue. But I wanted to thank both of you for coming on, and I do apologize that we don't have more time. So there is a breaking news story, and I'll talk about that in a second. We're going to do a changeover to that, but I have to bail on that even because unfortunately I do have other restraints. I may try to do a bit of a mobile in on that, but I do need to go. But I wanted to thank both of you for coming. I think this is a very difficult topic, and as I had said also in the green room as we were getting ready, it's not covered enough, and it's not covered enough. Chesh, I thought, brought up a couple of good reasons. It's not covered enough because I think the female one is considered far worse, and so if you bring up the male one, you're somehow ignoring female rights, and I don't think it's exclusive. I think when you're doing the rights of one person, that doesn't mean you're ignoring the rights of other people.
It's
There's
all
a lot
genital
of problems.
mutilation.
Yep. And I think it all needs to be really universally opposed. And I think you guys have done a great job. I think would like to talk also maybe about having you back on. This probably should have been a 2-hour show, quite frankly. It wasn't something we could do, but we were thinking afterwards, you know, we may not have the time to cover the full thing, but I really sincerely appreciate having you guys on. Thank you very much. It wasn't easy for anyone, and I think we had sort of said we might use a little dark humor and joke a bit more, but I think that was too difficult for anyone to do. So thank you very much. I appreciate it. What I think what we're gonna do is there is gonna be an after show, and in the after show, these two lovely ladies will be there. Like I said, won't, but we are going to push the after show back. Ansgar will have the link. It's in the description for the after show. There's also if people want to get into the group chat to stay up to date on it, but you can also just come into the next. We are about to, what we're going to do is we're going to shut down, we're going to reset all the systems, and we are going to go live again. We're going to simulcast once again to both the GDC and our channel. It shouldn't take more than 5 minutes to set up. We are going to be inviting a guest, Red's Rhetoric. We may have other guests coming in, but in particular, Red's Rhetoric. There is currently a rather significant YouTube attack going on, attempting to get a number of debunking channels deplatformed based on false copyright claims. And it's apparently a very significant attack. So what I think we're going to do is I will be here to just sort of help set that up, and then I have to go. I may remote in, but that will all be up in probably 5 minutes. The thumbnails will be up any second. Please join us for that. We will be live with Reds in about 5. Thank you guys again for coming, and I look forward to you guys being in the after chat, after the after show, and discussing it some more. So thank you.
Anytime.
Thank you, everybody.
Thanks.
Bye.